Welcome everybody. We've just got a few people still joining us. So today's event is our National iThrive programme webinar on approaches to enhance children and young people and families' understanding of the Thrive framework. And we're really delighted to have a range of presenters with us today, which I'll go through and introduce in a moment. But perhaps if we are quite tight for time, so perhaps if we just move on and set the scene for today's webinar. So I'm Rachel James and I'm the Clinical and Programme Director for the National iThrive programme, also one of the authors of the Thrive Framework for System Change. So great to be here with everybody today. We just wanted to let everybody know that we will be recording this webinar to enable us to load it onto our website. So it's obviously quite tricky in our modern world. I think we're all familiar with using Zoom and Teams, but if you could keep your cameras turned off and mute yourself unless you're asking questions, that would be really helpful, because otherwise you will have a presence throughout the webinar. If you need to communicate any technical issues, please use the chat function to do that, which will be monitored by one of the team, and we'll be able to attend to that as soon as possible. If you have any questions or reflections on the content of the presentations, please also submit that using the chat function. And if you've got a question directed at a particular presenter, it'd be really helpful if you could just say who you'd like to address that to, just to make it easier and more efficient for us to be able to direct that question. When you submit your question, you do get an option to submit anonymously if you would prefer to do that. So with it being recorded, you might prefer that, but obviously if you're happy for your name to be shown on the recording, then please do keep your name there. We will be sending out the slides following the webinar, as well as the link to the recording, so you will be able to share the webinar with any colleagues who perhaps haven't been able to join just because of other commitments, and also to support your teams in understanding a little bit more about some of the themes that we cover today. And then if you have any questions or reflections that you would like to share following the webinar, please do send them to the National iThrive programme team at the email address there. Perhaps we could also just pop that into the chat. It's ithriveinfo@tavi-port.nhs.uk. And similarly, if you've come to the webinar through a different route to our community of practice, if you wanted to sign up to our community of practice, where you get all the information about the events that we are delivering on a rolling programme, please do let us know by emailing that address. Because of GDPR, we do need people to actively request to sign up to the newsletter for obvious reasons. So thanks very much to everybody for that and for your patience in just going through those housekeeping moments and issues. So I'm going to start today's webinar with a bit of an overview and introduction, and connecting what we're going to be covering today with the key principles of the Thrive framework. And then I'm going to hand over to some colleagues, Catherine Lawler, who's a training consultant with Oldham Safeguarding Partnership, and her colleague Lisa, who are going to describe the work that they've been doing in ensuring that the Thrive framework is understood by young people in Oldham with their Oldham Bees project. We then are delighted to be able to welcome Jane McGrath from We Co-Produce, who's going to help us by setting the scene of co-production and putting it in context of work with children and young people that We Co-Produce have been involved in. And we're delighted to be able to welcome a service user, Maya, who is going to talk us through her lived experience of co-production and why it's important for service users and the difference that it can make. We're then going to move on to hear from Neelam Solanki, who's an assistant psychologist within the National iThrive programme, and hear about a piece of work that's been taking place through co-production with children, young people and parents and carers to develop some leaflets in relation to the Thrive framework for system change for service users. We're then going to have a Q&A, so there'll be opportunities for you to ask any questions of the panel. And we would also like to get feedback from all participants in relation to today's experience of the webinar through Mentimeter. So we'd be really grateful if you would just take some time to give us a little bit of feedback in relation to today's event. And then we will be aiming to close on time at midday. So thank you very much for that. And if we move on to the next slide, I think it just really helps to give us a context of what co-production is. And we've got a quote from Stevens et al. Here, where it emphasises that co-production is about broadening and deepening public services so that they are no longer the preserve of professionals or commissioners, but a shared responsibility with communities for both building and using a multifaceted network of mutual support. And we chose this quote on co-production because it really emphasises that shift away from a paternalistic driven approach to the delivery of services, which particularly perhaps healthcare services have been challenged in over many years and for many reasons in delivering in a quite a paternalistic way. So really emphasising the focus on ensuring that the services are co-produced. Now, in relation to the Thrive framework, what we wanted to just think about is the core principles of the Thrive framework for system change and how we can bring them to life in meaningful ways for children and young people. And I know that not everybody on this call today is necessarily implementing the Thrive framework for system change in their local area. So we thought it's a good opportunity just to revisit the core principles and think really or raise the question about what do children and young people understand by those principles. So at the core of the principles for the Thrive framework for system change is that there needs to be a common language. And the Thrive framework and its conceptual needs-based groupings really support a shared language and understanding across the local system and local population that's easily available, accessible and communicated. Now we know obviously there are different languages that are used across the different sectors, and that's really complicated and confusing for children, young people and their parents and carers. And hopefully in one of the presentations we'll be looking at ways in which that's been brought to life. Another core principle is about services being needs-led, and that the Thrive framework is based on meeting need. It's not geared around diagnosis or severity, and it's explicit about the definition of what a child or young person's needs are at any one point, what the plan is to provide help or support for the children, young people and family, and everybody's role within that plan. Fundamental to that is a common understanding of the needs-based groupings across the local system, taking into account the needs of the different communities and populations in any given locality. Now, shared decision-making is at the core of the Thrive framework. And of course, the voice of children, young people and their families are absolutely central, particularly for those who may have previously experienced being disempowered in decision-making processes about their care or about any support they might have received. And another key principle is about proactive prevention and promotion, whereby the whole community is supported in relation to mental health and well-being. And that does involve proactively working with the most vulnerable groups. We know from a wide body of research that there are particular groups of the population that are much more vulnerable to mental health and well-being difficulties. And we really need to focus on how to help children, young people and their communities to build on their own strengths and resources and assets, and including safety planning where relevant and appropriate. And moving on to thinking about partnership working, we clearly need effective cross-sector working, including service user participation and co-production, where there's genuine shared responsibility, accountability and mutual respect across the system that's based on those 5 needs-based groupings. And for too long, perhaps, we can all connect with some of the challenges in the way in which services perhaps have internal hierarchies, and where there are different approaches to supporting children and young people access different types of help and support. And it really does challenge ways in which we have developed our systems and services that really needs us to come together. And we've seen through COVID, there's some really, really fantastic examples of partnership working across systems, but also under stress, we know that there are additional challenges in the potential for continued siloed working to really be able to manage and cope when faced with such challenges. So, you know, now more than ever, the focus on partnership working is obviously crucial, and at this moment in time, thinking about the work that we're all doing across the country in moving towards integrated care systems. Another key principle of the Thrive framework is about ensuring that our work is outcomes informed and having clarity and transparency from the outset about children and young people's goals and measuring progress towards those goals, with very clear discussion if goals are not achieved or if progress isn't continuing, so that there can be a full range of options that are considered, which includes personal and community goals and approaches, but also where we're transparent about the limitations of treatment and ensure that any interventions that are discussed with children, young people, parents and carers have an explicit conversation about what the limitations may be of a particular intervention that's provided. The core focus of the Thrive framework is to reduce stigma. And as everyone who has been involved in the community of practice, you know, really working hard to ensure that mental health and well-being is genuinely everyone's business, and the role in which we can play in supporting communities to access support with a consideration of their beliefs, any existing support systems and their individual and cultural needs. And of course, ensuring greater accessibility to mental health and wellbeing help and support, and ensuring that advice, help and risk support is available in a timely way for the child, young person or family, wherever they are in their community. So quick run through there of the core principles of the Thrive framework for system change. And if anybody wants any further information on that, please do go to our website, which is www.implementingthrive.org. Again, we can put that in the chat so that you have that as a resource to be able to draw on. As a wealth of resources within that. Okay, so now I'm going to hand over to Oldham, Catherine Lawler and Lisa Slater and Lisa Morris, who are going to present their fantastic work they've been doing in Oldham of co-production using the metaphor of bees. Over to you. Thank you.
Thank you, everybody. My name's Catherine Lawler. I'm the training consultant for Oldham Safeguarding Children's Partnership. And I'd just like to introduce my colleague, Lisa. Is Lisa there?
Hi, my name's Lisa Slater and I'm the operational manager for the Oldham CAMHS service here in Oldham.
Thanks, Lisa. Next slide, please, Neelam.
Okay, so we thought it'd be useful just to give you a little bit of information on what we're doing locally. So we within Pennine Care, so that's the trust which we're part of, we've actually been involved with the Thrive model before COVID. Actually, there was life before COVID, I assure you. We've been involved for quite some time, and over time we've really tried to embed the approach in all aspects of our work. So one of the things that we have done is we have care pathways, so pathways for our neurodevelopmental difficulties, attachment, assessment, emotional disorders. They are all Thrive aligned to be able to first of all support our families and young people in knowing, you know, where they can go to if needing additional support, and also to support the practitioners themselves. Alongside that, what we've done more recently, which is very exciting, it's took some time, but we've got there, we have an electronic record system called Paris, and now that system is also Thrive aligned as well. So that's been, and that's over the last month or two, so that's been a really big step forward for us. In addition to that, so we were very aware that as a health service, we were really running forward with this model and really wanted to try to bring on board partner agencies. So within Oldham, we have a mental health support team that works primarily in our schools, and so they now are using Thrive language out in the schools to really try and embed that within our school environments. We do training here, so we train our partner agencies, and on the 23rd of June, something which Catherine is leading, we're doing an internal iThrive launch for all partners, including our VCSE partners, and that's running through our Oldham Safeguarding Partnership. So that's going to be a really big event, and that's where we're going to also launch the bees as well to those people. And then one of the other things that we're doing is we're doing an iThrive service directory as well, so that all partner agencies are aware of what services are out there, and also then to be able to support our young people and families to know what is out there as well, because things change so quickly. So yeah, go over to you, Catherine.
Thank you. Okay, hi everyone. So the next slide really is just talking about how we attempted to contextualise the narrative in relation to iThrive for children and young people. So Jo Needham, who is the Assistant Director of Healthy Young Minds in Oldham, and myself were part of a task and finish group looking at mapping training in relation to sort of trauma, ACEs and mental health, and aligning that to the Scottish model, which seems to be the model that most people are using. And from that task and finish group, Jo and I were discussing how we could involve children and young people in really helping grown-ups understand the narrative around iThrive and being more comfortable having those conversations with children about resilience and mental health, etc. in general. So the obvious answer was to ask children and young people themselves to help develop a model. So we approached our Oldham Youth Council, and just to say here that prior to this, Oldham Youth Council did a massive piece of work in Oldham around children's mental health, and I will try and get hold of the report actually and send it to the Tavistock, because I do know that they consulted with over 3,000 children around their views of mental health and how they felt their mental health was impacting on them. So we do consult with Oldham Youth Council, our Children in Care Council, we consult with schools and colleges. We've just done another big piece of work actually on healthy relationships and hypersexualisation. So I think we have got a really good track record in Oldham around working in partnership with children and young people and letting them lead on that. Next slide, please, Neelam. So again, this slide, very simple, as you can see, just talks about the next steps in our journey. So Jodie Barber is our very dynamic youth service manager here in Oldham, and she very kindly organised a meeting for Jo and myself to meet with a big pool of young people. I think there were probably about 15 or 16 young people from sort of 8 upwards to 18, 19. So we had a really good age range of children and young people that we met, probably about 18 months ago, actually. Next slide, please. Okay. Lisa?
So, yeah, thank you. So as Catherine said, so they met with the young people in the Youth Council to talk with them about the Thrive model. And I guess, you know, when we talk about common language and the principles of the model, it was really important that actually for us, we wanted to be able to get across to the young people how the model works, because I think it's all very well and good, you know, just presenting something, but actually if you can't make it real and personal for young people, I think it can be really quite, you know, sometimes things can be difficult when you've got to learn new things. So one of the things that Jo did when she was talking with the young people about the model was actually, as she was going through the model, was making it specific to difficulties that some of our young people may experience. You know, so for example, in respects of signposting and getting advice, you know, Jo was able to talk about that. Actually, some young people may experience, you know, just general worries and day-to-day worries, and actually what can they do when they have those day-to-day worries, and being able to get advice and being able to be signposted to alternative services, not necessarily having to come direct to a specialist service, may actually get the needs of that young person met much quicker. And then she moved it on to when we were thinking about getting help and talking about how sometimes for some young people that signposting may be helping, but also there may be some other ongoing difficulties for them, which might be exacerbating some anxieties. So they may be needing some support, say through a school counsellor, pastoral, or a local VCSE provider. In Oldham, we have a service called Tog Mind, which is Tameside, Oldham and Glossop Mind service. But then talked about how sometimes for some young people, they may go through 8 sessions of counselling, and actually they feel things are getting much worse. They might be feeling more anxious. They might then start to be feeling quite low in mood, maybe experiencing thoughts of maybe wanting to hurt themselves. And actually at that point, it might be thinking about, right, okay, so we've still got the support from school, we've still got the support from the pastoral, but is there something else we need to think about as well? And at that point, we then might start to think about, is there a role here for the local CAMS service, or actually the mental health support and the mental health support teams? And then she talked about how for a smaller minority of people, thankfully, that actually even with the level of support coming from pastoral and school, coming from family, coming from CAMS, that actually things are getting really bad, and they may be experiencing very intrusive thoughts, or, you know, thoughts about how, you know, feeling like overwhelmed with their emotions. And actually there may be risk factors then that we need to start to bear in mind to be able to safeguard and support those young people. And I think doing it that way, the young people were able to follow a journey and maybe themselves think about their own experiences, and thinking about when they're working, you know, with an iThrive model, that actually isn't about moving from one to another, that actually we can be in all aspects of that and still be accessing the support we're needing at that time. Yeah, so that's that. Thank you.
Thanks, Lisa. Next slide, please. Thank you. So the meeting was fantastic, I have to say, as usually meetings with children and young people are, because we are not them anymore, and they tend to be a lot more creative than us, in my opinion. The meeting was absolutely excellent, and there were lots of ideas thrown around, and it was actually a 10-year-old girl that came up with the concept of the bees, and the rest of the children and the young people just sort of jumped on that as if it was almost like a light bulb moment. So for us in Manchester, obviously we've had real tragedies in Manchester in relation to terrorist attacks alike, and the bees for us as Mancunians are a symbol of hope and resilience, and support, and you know, and being proud of who we are. So I just thought that was an absolutely genius idea, and the rest of the young people were in consensus that we would then use the bees and align that to our iThrive work. So we divided them into 2 categories. So tweens, obviously the younger children, and teens, obviously for the older children. Next slide, please. We'll be able to show you some graphics now. So here's our tween graphic. So as you can see, each bee or image is aligned to each quadrant. So Lisa's beautifully illustrated how Jo beautifully explained the Thrive framework to children. So the children decided on getting advice, maybe 2 bees sort of having a chat, just chewing the fat, having a chat, finding out what's going on. Getting help they wanted a door. In other words, come in, I can help you. This is a welcoming space. So really simple, but very sort of powerful images, I think. Getting more help, you can see there's loads of bees there. You've got lots of different agencies or people coming in to support that child or young person. And for me, the genius of this meeting was the children and young people talking about high wire ropes and falling off things and having a safety net, which I thought was an amazing metaphor for sort of risk support. So we put that safety net, 2 bees holding the safety net in for risk support. And as you can see in the centre of the graphic there, that's thriving. So you've got your hive and your flowers and your trees and all the things that you need, all that good stuff that you need inside you to help you thrive. So that is the image that the young people came up with for the tween one. If we can have next slide for the teen one, please. Thank you. So this is the same, as you can see, it's just that we've made the graphics a little bit more grown up. So the bees are, you know, they're a bit more adolescent and less sort of fat and furry than the other ones. And the image in the middle again is a little bit more adult around sort of that honey pot and how we thrive. So personally, I was really energized after we came out of that meeting, and I was really energized after the children had signed the graphics off. I'm really actually very proud of them. So this is our little image that we will be using in Oldham. Next slide, please. Okay, so we've got an image, so we wanted to connect a narrative to the image. So I was given the task to write a poem for the tweens one. I could not have attempted a rap because I am just far too old for that. That would have been completely inappropriate. So the young people took the rap to do as a task, and I took the poem to do as a task. And what we wanted to do is create some narrative that actually made that those images come alive and sort of make sense, that people can use it if they wish. Next slide, please. So just before I attempt to rap for you and read the poem for you, which I have practiced and it doesn't sound great, but I'll do my best. Just a little bit about endorsement and sign off. So obviously this work comes under the banner of Oldham Safeguarding Children's Partnership. We have a really robust partnership that I feel works well, and we work, you know, me and Lisa have been working with each other for years. We have really good relationships with our partner agencies. So as well as being signed off by the partnership, as I say, I just want to reiterate that this was a core task of the children and young people's emotional and mental health and well-being, a very long title partnership. So this work did sort of dovetail into the more strategic work that the borough is doing around children's mental health, which is one of our priorities at the moment. Next slide, please. So now I'm going to attempt to read them to you. So we'll do the poem first. Now, Bella or Bertie, it can be any name, it can be Bilal. I just thought rhyming with B was easier for me when I was doing this poem, but it doesn't have to be Bella or Bertie, it can obviously be any name. So let's have a listen about Bella's journey around the tween thrive model. So once upon a busy time, Bella B did not feel fine. Her wings were droopy, she felt heavy inside. She couldn't feel better, no matter how hard she tried. It started with a worry, something quite small. But the more she worried, her worries did sprawl. Next slide, please. Bella talked to her dad, she talked to her mum about the worries, thoughts and feelings in her head and her tum. Mum and dad tried their best, but Bella's head and tummy, they could not rest. Feeling unhappy was so much like riding a broken down wobbly bike. I think we need more help, a helping hand, someone else who will understand. So off they went to see what help they could find. They met new worker bees and bugs who were helpful and kind. Bella wanted help, she had important things to say. So the worker bees got busy to help her find her way. Sometimes Bella needed lots of help, and sometimes she just needed hugs. But it was good for her and Mum and Dad to know about the worker bees and bugs. Her worries might have got the best of her. Your worries might get the best of you. But worries find it very hard to get the best of 2 or 3 or 4. So hopefully that will illustrate to children and people going with the images that we've got. We can look at Bella's journey and where she might be on that journey and where she sort of needs to be on that journey. But we wanted to finish with that sentence around that if we can talk about our worries and get them out in the open, then that is a good thing to do with children, and young people feel ready to do that. So it was very much about sharing. And when we're going to do the launch on the 23rd, we will obviously, we've got longer time for that. We'll be doing more presentations about how we're working locally, but actually the importance of trusting relationships with children and building rapport with children, using appropriate language with children. So we'll be giving staff more injections of knowledge about that process. So if we move on to the wrap, this is going to be the harder one for me. Okay, this is brilliant. Okay, I thrive. I want to be involved in decision making, in the options for my mental health and well-being. You can give me all of your advice, or signposts to others will suffice. Maybe one-off contacts for support, maybe self-management with the ball in my court. Just don't leave me to try and survive, but do all we can to make sure I thrive. Or maybe I'm someone who needs focused goals, someone with a specific intervention role, getting help to be transformed, but only interventions, evidence informed. It doesn't even have to be a nurse. Any trained professional can help reverse. My mental health and well-being will revive if we do all we can to make sure I thrive. Maybe I need more help than first thought, extensive treatment so I'm not distraught, professional help from local services, people in the know with specific purposes. I have needs that require particular attention. It just needs a little local coordination. All I need is an intensive session or 5, and we can work together, making sure that I thrive. Thank you. Everybody working to manage a risk. Any crisis response will need to be brisk. Maybe the help isn't working, or maybe I'm still searching. We might even have to resort to keeping me safe with multi-agency support, working together, not just to keep me alive, but me, you, them and us, making sure that I thrive. Next slide, please. Lisa.
Okay, so thanks for that, Catherine. So I guess we just want to finish with just thinking a little bit about being curious and not furious. We all know that often children communicate very differently. They don't always come over and tell us exactly how they're feeling. They may present with behaviours that sometimes, you know, we might find that little bit more challenging as professionals to be able to understand or be able to take forward. So we just want to leave you, I guess, with the thought of the I notice, I wonder, and just being more curious with our young people at all times. Thank you.
Thank you very much.
Wonderful. Thank you both, Lisa and Catherine. That was very inspiring. And I know that you are planning on, for your big launch event, that young people will be presenting both the poem and the rap. And I guess I just had a thought then, it'd be really fantastic to be able to record it. And I know you've done an implementation story in relation to this work. And if we could join those up for people to be able to draw on that resource, that would be really fantastic and really showcase that fantastic.
Yeah, we can sort that out, I'm sure.
Wonderful. Thank you.
Thank you.
So there's lots of comments coming through on the chat. Now we do have a Q&A section at the end. So if anybody has any questions, please do pop them in the chat and direct them to Lisa and Catherine if you want to know anything more. But as discussed at the start, we do have a tight agenda, and I'm now really delighted to introduce Jane McGrath, who from We Co-Produce, who's going to set the context of co-production for us. So a huge welcome to you, Jane. Thank you very much for joining us this morning. If you just want to pop your camera on and come off mute, then we'll be able to see you.
Okay, I am on.
There you go. Brilliant. Hi, Jane. Fantastic. Thank you. Over to you.
But can I just check what time I'm finishing, just so that
Yeah. So we've got Maya presenting about why co-production is important for service users at 20 past. So you've got 15 minutes.
Brilliant. Thank you very much.
Thank you.
Yeah, hello everybody. It's lovely to have this opportunity to be able to talk to you. I thought maybe what I should do is spend a little bit of time just talking about the organisation that I run and how it came about, because I think in itself it was co-produced, and it's a really good example of how communities can be empowered to actually do some of this work themselves. So I'll spend a little bit of time talking about that. And I'll give you I'll just talk through some of the projects that we've done, and I will then talk through something that we produced with NHS England, which is a guerrilla guide to co-production, which might start to help us think about ways that we can, tools and tricks that we can use to make sure that we get the best results. But I must say, just listening to that previous piece of work is absolutely amazing. It's really inspiring, particularly like I love to hear that the way you've been working so closely with children, because a lot of the work we do, people still struggle with that. It's like, oh no, but we want to work with the parents, or we don't know, they're a little bit young. So it's really inspiring to see that. So yeah, just to say, I'm chief exec of an organisation called We Co-Produce, and I'm somebody who has lived experience of mental health, but prior to becoming unwell, I was teaching at a university, teaching art and teaching contemporary communication. And when I became unwell, I went into the system and was absolutely sort of horrified by what I found. I suddenly disappeared and was invisible and stopped being seen. And slowly got involved in, I guess, more kind of activist work, like trying to sort of change the system from outside. And then it became apparent that actually it'd be more effective if we could work with each other inside the system and talk around the table and try to do things together. So at about the same time, there was a big push on recovery movements in mental health. So the whole push around recovery colleges and co-producing was put on the table, and we were given, the chief exec of a local mental health trust in West London put nearly £500,000 on the table and said to the people who were using the services, okay, it's over to you now. Well, what do you want us to do with the money? What should we do? What would you like us to do, or what do you want to do with the money? So in short, there weren't many people that stood forward, because it's quite a daunting thing to be given quite a big chunk of money like that. So a few of us stepped forward, and over the course of a year, we co-produced with a community of about 100 people, an organisation that was to be a social enterprise. Local people were really key that they didn't want it to be a charity. They didn't want to seem that they were needy and unable to operate without a handout. So it's very important that it was run by local people for local people, and that it operated and could stand on its own 2 feet as a business. So that was in 2013. We grew inside the NHS until 2015, when we became a formal CIC. So that's our route. But I mean, why I tell that story is just to say that for us, one of the most important things about the co-production was the sense of agency that it gave people who were very unwell at the time, many of whom have gone on to work, not everybody, but some people have gone to college, some people are still very unwell. But the actual act of co-producing, as not just delivering a service improvement or a service change, it can have a profound effect on how people value themselves, and it can also, for some people, act as a gateway back into work or college. So the benefits from a sort of social point of view are really important. It's not just service improvement. So that's that. So yeah, so then we went on to do a series of projects that were actually driven by the community. And I think that's an important point to note about co-production, because quite often it can take a quality improvement route where it's like something's wrong in what we're delivering, we need to improve it. How can you help us to do that? And what this was doing was really going out into the community and to frontline staff, so everybody was seen as equal. It was about going out and sort of saying, well, look, what are the biggest issues that are floating around at the moment? And when we first started, there were issues around restraint, around having shared decisions in medication, and I can't remember the other one, but they were and they were really difficult issues. They weren't things that were kind of easy to remedy, because as we started to collaborate as frontline staff and people who use services and carers, we found that we all had very different narratives around it. And we started off the project around restraint started off as eliminate restraint. That's how it had first come out of the big community meetings. But by the time we'd collaborated, it was eliminate the need for restraint, because people began to understand that sometimes for patients to feel safe on wards, there had to be the option that if there was a threat, that patients might need to be restrained for their own safety and other people's. So what we learned from that is that we need to form the questions together, not just the answers. That's a real fundamental part of co-producing things, is starting as much with a blank piece of paper as you can. The other sort of key learning, now I reflect on it, is perhaps it's not great to start with really difficult problems that people, because it can get disheartening. You know, we've been working on the restraint one for like 8 years now. Haven't got, you know, we've got progress, but it's definitely not resolved. So so other pieces, so we've done many other pieces of work, and what we do as an organisation is we use the arts, which is why it's really inspiring for me to see the poetry being used, and the really careful and considered use of the bee. We spend the majority of our sort of thinking around how do we co-produce with people in a community in a way that's not going to be alienating. So for that, we use the arts. We had a stand-up for men's mental health. We had a stand-up comedy night with some mouse comics, and you know, there was it was in a sort of a stand-up comedy venue, and it was just talking about mental health in a very different way. For young people, we do a lot of work around spoken word. So in a very similar way, we'll get young people to write and perform their work, and it seems to be a really powerful way of getting through to young people. So another piece of work we've done is with the early intervention psychosis teams for young people, and again it's about investing in music and helping them to giving them opportunities really to perform. So what we like to do is to sort of help them say what they want to say, but in a medium that works for them, and can also give them a platform, so that people see them not only as kids who've got psychosis or are struggling with that, but you know, as rounded whole human beings who've got a load of skills and talents as well. So yeah, they're just a couple of the pieces of work that we do. I'm trying to think of what other stuff we do. The other thing to say is we've got a radio station. So the community co-produced a radio station, because what people said is they don't really want to go to meetings all the time. They don't want to go to board meetings. They want to have open and honest conversation between each other in the community, and they want to be connected and networked. They don't want to be isolated. And it came out of one of our community forums, and we were saying, well, what else do we do? You know, and the idea for a community radio station came up. That launched last right at the beginning of COVID. We brought it forward last year, and we've got connections with what's it called? So we've got connections with a big charity called Last Night DJ Saved My Life. So we work with young people to support them, and then we support their work they're doing in Tanzania as well. And so, yeah, so what we do is we try to use the radio as a platform for people, including young people who are talented and gifted, to show their, to talk about what matters to them, but also to showcase their skills. We've got an 11-year-old who talks about street crime and bullying, and she's also a brilliant rapper. She's doing a special with us this month. So, yeah, we try and use different mediums as much as possible that are owned by the community. So just to sort of, is it possible to share my screen? And I'll just show you the Gorilla Guide that we use.
You should be able to share, yeah.
Okay. Let's just see if I can. So hopefully you can see this. Can you see that?
Yeah.
Yeah.
Yeah. So basically, a couple of years ago, so we've been doing in this co-production space since 2013, and the biggest challenge that we have is everybody agrees with co-production. No, I've not yet met anyone who kind of disagrees or struggles with the idea. But where it gets confusing is that there's so many varied understandings of what people mean by co-production, and some people think of it as something very similar to consultation. For me, it's something that has its root in social justice and is looking very much around how you share power. And I'm very inspired by Edgar Khan and No More Throwaway People. That kind of route is very important to us as an organisation. But if you go and work with the NHS, they'll talk about co-production very much in a quality improvement framework. So it's about, you know, how do we make sure the food isn't cold when it arrives on the ward? So it can be a lot of system-based improvements. So one of the things we wanted to do was to start to think around what is co-production and what does it mean and how do we all understand it. So we co-produced this, what is called a Gorilla Guide to Co-production. And if people want copies, I can put forward some that you could send out if that's useful. And yeah, it's basically, you're just seeing one side of it here, but it's a working document that is really, it's like a handheld map. And it's around talking about all of the little drawings and sketches, because they've all got some sort of symbolic meaning around that might prompt a conversation about co-production. Some are very obvious, like the ladder, and some of them, like the record player, always prompts conversations about bringing different voices into the room, you know, about broken records, about that it takes, that we should all be able to tolerate each other's voices, and what, even if we disagree and we don't actually like what people say, we should be able to have the space to listen to that. There's the clocks on the wall, which are very much around time. Is there time to do this? The big power sign on the wall, because that's a real big thing. Like who's holding all the power here? Is it the people organising the co-production, or is it the community that are engaged in it? Yeah, and right in the middle of the room you can see the big blank canvas, really. And it's not actually a blank canvas, it's got a bit of scribbles. You can see where people have tried to do stuff on it and maybe rubbed it out and started again. And it's really about saying that it's not a science, it's not about being perfect, it's just about doing your best and seeing what comes out at the end. But yeah, it's a really helpful tool. And on the flip side, there's lots more factual, much more sort of writing about co-production and where it comes from and what it's about. So we found that that's quite a good conversation starter when we're trying to work with communities to think about what the potential for working together is. So I think that's probably as much as I can. Are you having questions or?
We are, yeah, thank you very much, Jane. We are, and there's a few comments in the chat, and a number of people have said they definitely would like copies of that Gorilla Guide. So it'd be great to get some of those hard copies, and we can help to distribute those. But a thought that I'd had also is that it might be really fantastic if we could develop an implementation story with you that we could showcase to really help people that connect with this Gorilla Guide around. Yeah, and be able to distribute wider, because I think it's something that sounds like a fantastic resource. And we do have a Q&A slot at 20 to 12. So If you're okay to finish there for now, and if people have specific questions and you're happy to stay for that slot leading up to midday, then we could ask the questions then, because I'm just very mindful we've got a young person, Maya, who is about to present on her lived experience of co-production and why it's important for service users from a young person perspective. So it'd be a perfect time to move on to that now, if that's okay, Jane, and you stay for a question Q&A. Brilliant, thanks very much. So that's really, really wonderful and fantastic to see that Gorilla Guide. Thank you so much for sharing that, and we will come back to you in the Q&A. So now what I'd like to do is to introduce Maya, who is here to share with us a little bit of her personal experience in relation to co-production and why it's important for service users in terms of what service users themselves gain from being involved in co-production activities. So I know that Neelam's just going to change slides. Thank you, Neelam. And so if I can invite Maya just to show herself on the, take the camera, put the camera on, and take yourself off mute, and then I will hand over to you for your presentation.
Hello.
Welcome, Maya. Thank you. Over to you.
Can you hear me?
Yeah, great.
Okay, cool. So if we could go to the next slide, there's a bit of a timeline. Just a bit of background on my experience. So when I was about 14, I started to engage with community CAMHS because a lot had happened and I was struggling with life a bit. I stopped going to school and seeing friends and family. I was in bed most of the day, not really talking or looking after myself, and being actively self-destructive. So my GP referred me to community CAMHS. When I was about 16, I was referred to an intensive support service when things went downhill. And I just wasn't really in a place to make use of what was being offered through community CAMHS. So this was sort of after a few weeks of not eating and drinking, I was referred to the intensive support service. So when I was there, I started going to a hospital school after not being in education for a couple of years. But it wasn't straightforward, and I did need some inpatient stays along the way. So my involvement with co-production started when I was, I think, 16, and I was invited to join a staff interview panel by some of the people that I'd been working with and had trusted relationships with, and they were on the panel, so they invited me into the room with them. They talked through what would happen and said that they would pay me and give me lunch before a couple of days before. And I saw it as a chance to do something different, aka get out of school for a couple of hours. But I was quite interested to see how decisions were made to hire staff and all the thinking around that. So yeah, so they only invited me a few days before the interviews were going to happen, but that was actually quite good for me because it meant that I couldn't build up worries in my mind or anything. It was just I was told sort of what was going to happen and then did it basically. So it was quite stress-free for me. It was quite a fun experience, the interview itself, because there was a group task and then the interview panel later in the day. So I had to observe the potential support workers do an activity together in little groups where they built a tower out of dry spaghetti and marshmallows, which is quite funny, as it seemed a little bit ridiculous to me that they were doing something that I'd done in year 8 science to get a job. But it was really interesting to see that the group dynamics were a really important part of the recruitment process, and they wanted to see how people would work together in a team. And I was quite surprised about how valued my perspective was. The staff members on the panel made a point to invite me to give my view. at all stages, and my contribution mattered, and did actually contribute to the decision making. And I was indeed paid and got my lunch, and thought I would quite like to do it again. So since then, I've been on interview panels for support workers, nurses, occupational therapists, assistant psychologists, and bed manager position as well, I think. And most of the time, the questions that I've asked have been related to young people. And I've always been asked if there is anything in particular that I would like to ask, which really helps make you feel that your contribution is valued. So after that, it sort of moved into training people, I guess. I've been involved in training students about communicating with young people, helping them develop their skills in working with young people. And I've been involved in role-playing scenarios with them. This is on a MSc course that I first did this with one of the staff members that I knew from doing interviews. So it sort of developed from the first step into co-production I took, I guess. And following on from that, I then have presented at a few different conferences, which is quite daunting, but it was good and felt good to be invited to those sorts of places. And I did these with one other service user who at the time I hadn't met, but have since met a few times through these various things, and a trusted support staff member. So I had a sort of support net around me for the bits that were more stressful to me. Yeah. So sorry, I've got my notes, but I'm a little bit yes. So hospital rooms was the next sort of big thing that I was involved with. As Jane was saying, the arts are really useful in expression, and especially for young people, I think words are difficult. And Hospital Rooms is an arts and mental health charity that commissions artworks for NHS mental health inpatient units. They ran an art project on an inpatient ward that I accessed through the day service. It was something that was just going on the ward while I was there, and had the chance to contribute to with other service users through group activities. They also got, so part of it was talking about how to change the environment on the ward. So we helped design different rooms in the ward. You can see on the slide there, there's a big wall that says "Believe Dreams," and that's in the family room. So when people are having family therapy or visits, there's a big mural that's like bright but not too in your face. It's actually quite calming to look at. And because I was involved in this, a work experience opportunity came up with the people who ran the art project, and I got to help them set up an exhibition around the work in an actual art gallery, which I was supported to go to with my key worker. I learned a lot about art exhibitions and that sort of world, which I did later use within my university applications, because I'm now going into the art world. So for me, as Jane mentioned, it was a link back to college, and getting back into education. All of these different things helped me to feel more confident to re-enter education, and sort of helped me find a route that I thought I could take, and not just stay at home all the time. So yeah, that's sort of the timeline of it. So here there's some top tips, I suppose. The first and I guess, most important thing, because it starts it all off, is to ask if we want to take part, because we as service users don't know what opportunities there might be unless someone invites us. And even if you offer for someone to get involved with something and they say no the first time, it's important to make sure that, you know, without pressure, I suppose, but to make sure that just because they said no once doesn't mean that they never want to be involved with this kind of work. It just might not have been the right time or the right thing. Number 2 is that trusted relationships are really important in helping us to feel comfortable and taking the first steps. As Catherine said earlier, I think that building relationships is really key to co-production and making things like these work. Third thing is check with us how much advance notice we prefer. So as I said, I prefer just having a short little while of notice, so that I know when it's going to happen, but I don't sort of spiral and think about things a lot and get overwhelmed with it. But obviously some people need a lot more notice to be able to plan or fit things into their schedule or whatever. Number 4, meeting beforehand and debriefing is really important. So before any of the tasks that I've done, so whether it was an interview panel or presenting at a conference or teaching students, I've always had conversations with the staff member that I was doing the work with beforehand, and we sort of have done like short run throughs, just a little bit of what the setup's going to be and what the expectation of me is, and then afterwards to debrief as well, and sort of make sure that you check in with them on how they're feeling about it. And, also, if it's interviews and things like recruitment and stuff like that, then it's really important to make sure that they feel valued and get their responses at the end. Number 5, stick to the original time. So if you make a plan to do something with a young person, make sure you stick to it, because we do have social lives and other things to do. Sort of a basic one, but you'd be surprised. Stick to what you say you'll do. Number 6, so make sure you do give money if that's what you've said you're going to do, or buy them lunch, or give them a reference if you say you will. Don't wait for them to ask you for it, as they are unlikely to. But this can really break trust with someone. Next slide, please. Can we have the next slide? Yeah, thank you. So yeah, when on interview panels, it's easier if we ask questions that have relevance to us. So things, maybe if it's for a support worker position, for example, asking about how they connect with young people or different things like that, rather than the more sort of managerial questions, because it can feel a bit strange if I'm sitting there going, I don't know, what do you do if you have to work overtime or something? It doesn't really make sense. So things that are relevant to us are good. If it's a task that could be anxiety provoking, so something like speaking in front of 35 people, it may be helpful to have another service user there for mutual support. Or of course, if you have a trusted relationship with a young person, then that is key. But so when I presented at a conference, that was a very nerve-wracking thing. I think there were about 100 people in the audience, and this was pre-COVID, so it was in person, and it was a big hall, and it was quite scary. But I knew that there was going to be another young person there. So even though I didn't know them well, it was a sort of a relief to know that it wouldn't all be on me to hold it for the whole time. Number 9, even though you might have service users that you draw on and work with in those trusted relationships. Make sure that you do continue to engage people from diverse backgrounds who can offer different perspectives. Because, you know, once you have someone who's willing to do it and you do have a good relationship, then it can be very easy to just go back to that all the time. But actually then that does limit the perspectives that you get. Encourage young people to share things that have made a positive difference, not just the things that should change or that people shouldn't do. This is an important one. I think it's good for people to hear positive things that do help, but also it's good for the young person because they get to talk about something that was actually good rather than constantly talking about negative things that have happened, and it can help them actually come away from the event feeling positive in what they've said and not just that they've relived terrible experiences or whatever. And then the final one is that being invited back helps us know that our contribution is valued. So yeah, it's quite basic when you think about it, but if something's gone well and you're invited to do it again, then that gives a really clear message that it was really important to the event or the people that ran it. So yeah.
Brilliant. Thank you so much, Mare. That's really thought-provoking and really good. And thank you so much for sharing your personal information as well. You know, we do really appreciate that. It helps give the context to understanding your co-production journey. And just so that everyone's aware, those top tips came out of a dialogue in terms of Mare's experience in co-production. So we'll be very happy to share these as well, of course, to support others. But I'm sure people might have a few questions that they would like to ask Mare, and you might want to look at the chat and see some of the feedback that's coming through. People have found that really helpful, so thank you. And Mare is going to be around for the Q&A as well, if you do have any specific questions for her. So now I'm going to hand over to Neelam for our final presentation, who's going to go through an overview of the Thrive Framework leaflets that she's been involved in co-producing with children, young people and their parents and carers. So over to you, Neelam. You're on mute.
Only been doing these for a year, so I haven't learned how to unmute myself. But no, thank you very much, Rachel, and I'll try and be kind of prompt so that we do have like a really good Q&A session at the end. But yeah, I wanted to present on the Thrive Framework leaflets today. And just to give a little bit of background context, so as part of the National iThrive programme team, we're sort of based at the Tavistock and Portman NHS Foundation Trust, and we are, you know, sort of working on integrating the Thrive Framework across workstream, so any work with children, young people and their families. And there was basically feedback from a service user participation event, which was held, I think, late 2019 actually, regarding a lack of understanding of what Thrive category, or here, as you can see, category of care, Thrive, meant on their care plan, and also what that meant for them. So already, you know, care plans aren't the most sort of service user friendly or like person friendly document to receive anyway. But yeah, seeing this category that has no relevance to anything that you might know about was something that could be potentially quite jarring. And then obviously, you know, it says, it's one of the 5 needs-based groupings. So here, an example is getting help, but could be getting risk support, thriving, getting help, getting advice and signposting. So yeah, the feedback was, what does this mean? So what we aim to do from here is developing sort of care plan information leaflets. So yeah, as it says, the aim is to develop leaflets, send out with care plans across the Tavistock and Portman to explain what Thrive category, as i.e. needs-based grouping, that's what it really means, meant, and ensure that there's a shared understanding, a shared language about the type of help or support being received. You know, as Rachel went through the principles at the beginning of the webinar, that common language is something that's really key to the Thrive Framework and just with working with children, young people and their families in general. So the National iThrive programme team were tasked with supporting the development of the information leaflets, and we decided to go for one version for sort of young adults and parents and carers, and then another version for younger children or children with learning disabilities that was quite aligned with like easy read style documents as well. And in addition, we submitted a care notes, which is our sort of clinical system, change request to change the heading from Thrive category to needs-based grouping, which has now been done, which is great. So yeah, that's what is now sent out on care plans. And as you know, as this feedback had come from service users, it was really, really important to us and in general to ensure that we collaborated them with young people and their parents and carers. So the first sort of iteration, well, the mock-up that we did internally of these leaflets, bearing in mind that we have very, very limited sort of graphic design experience. So just, you know, Word documents trying to get across the crux of what the Thrive framework needs-based groupings are. So I know that it's quite small to see there, but the idea was we tried to kind of enable a springboard, so developing some drafts to support the discussions that we would then bring to a focus group, saying that this is what we've got so far. This is basically the sentiments of the different needs-based groupings. What do you think? How does it look? Does that wording make sense to you? Do you understand it? And then asking our service user participation group to show what information the leaflets might include and what they might then look like. So yeah, we took them to a participation group last year. And this is some of the feedback that we got from service users, which was like vital in the further iterations. So yeah, we held the group in June last year, and we asked the following questions. So what are your first impressions? What do you like and dislike? Does the wording make sense? Is it appropriate? Would a leaflet like that be useful to you? And we're, you know, sort of relieved to hear that, yeah, that is something that would be really helpful and would support their sort of journey through, you know, wellbeing services. What do you think about the look of the leaflets and what could be improved? And yeah, this is some of the feedback from service users. So, you know, being explicit, so thriving means that, and then going into it. The ambiguity of the word help and not really explaining what support is from and what that might look like. So adding those details, because you know the first versions were really simplistic, adding those details about how you'd review progress and what that actually entails. And then you know, other sort of ambiguous language that might make sense to us as mental health professionals, but you know, people are really worrying about me. Who are those people? And yeah, the use of the word I in making it personal, but is that the right thing? Is that, you know, appropriate for all service users? And also some feedback on the use of simple clip art pictures to sort of, yeah, make it a bit more of less of a formal document, I think. And yeah, another thing was the use of colour, which was really appreciated. So we also circulated it to a number of clinicians in our first iteration who were able to provide some really helpful feedback as well. So asking the same questions as the participation group, and this is some of the feedback that we got from them as well. So I'll let you read that and we'll circulate in the slides, but yeah, just liking the speech bubbles, noticing that there isn't a huge marked difference between the two leaflets, which then led us to wanting to create an easy read version. And yeah, and some other really helpful feedback. So from there, we updated leaflets to incorporate the feedback we received, added a background color. So yeah, so we changed the language, included some clip art, which we kept the same across both. And yeah, we circulated them back to service user groups to see you know what they thought. We were very and with the leaflet on the left hand side being the one for service users, for younger children, and the one on the right being for older children, young adults, parents and carers, being more detailed. And we were very aware still that it wasn't particularly, you know, the one for younger children wasn't particularly friendly for that group. So what we wanted to do with the support of the comms team at Tavistock and Portman is further develop the leaflets so that there is actually an easy read version instead of something that is a bit aligned. And then, yeah, updating both leaflets to include images for each needs-based grouping that were more specific, were larger, and just easier to read. So after quite a long process of feedback and, you know, adding to the leaflets and then sending around for more feedback and asking our peers for feedback and people we knew, so for example from Camden County Council, and within our learning disability and autism team within the Tavistock, who also have experience of using these kinds of documents, And some of the feedback we got from them is having big font across 2 pages for the Easy Read leaflet, clip art to illustrate the different needs-based groupings that were like big and took up as much room on the leaflet as the text as well. Separating the sentences onto 2 lines and ensuring that there's only kind of 1 clause in each sentence, as that's easier for people to sort of take in. And also we learned from our colleagues in Oldham about how effective the imagery of a safety net for support was. So we also incorporated that. So thank you, Catherine and Lisa. That was, yeah, really, really valuable. So from here, we've kind of reviewed as a team and sent to our comms. And I am now really proud, really, to present the most finalised version that we've got so far. So this is the young adult parent carer sort of finalised-ish version. So really keeping to the colours of the Thrive framework, of the needs-based groupings, and having really Thrive-aligned branding. And then making sure that the images as well, so we went for photos instead of clip art, which are reflective of like not only our service user population, but of a whole diverse population as well, and across the different ages of people who might be accessing any sort of services. So yeah, children, young people, young adults and their families, the whole range. So yeah, the wording is the same from before, and it's just spread across 2 pages because it's easier to take in, we think. And then finally, the sort of young children learning disability easy read final version. So yeah, sort of simplified use of colour so that there's not too much for your eyes to be drawn to on the page, and it's quite, down into columns so you can quite easily read down. And then keeping to a size 16 fonts, which is what's standardised for easy read documents. And yeah, using the same imagery for thriving and risk support with that wonderful safety net again. Thank you, Oldham. And yeah, just keeping it really, really simple. You'll notice that there's a lot less colour on this than the parents and carers version. So yeah, these are kind of the finalised versions. So obviously the next steps are to gain further service user participation group feedback to finalise the design and just gather additional feedback to incorporate, see if they like it, see if it's helpful, see if see if there's anything else that can be changed, because I guess the beauty of this is that we can continue to edit until it is close to perfect, because we really do want it to reflect what would be helpful. And then to pilot leaflets with different teams within Tavistock and Portman, find out the process that's best of sending them out. Also translate according to need with some of the other languages that are most sought in our sort of demographics here. And yeah, just be really, really responsive to what other people are saying, I think. And again, continue to incorporate that feedback and continue to ask people and service users what they think. From there, co-create an iThrive implementation story, documenting the process, the development of these leaflets, and sharing that with the national iThrive community of practice, and also making the leaflets available for our community of practice to use. So obviously there are some tweaks that need to be made. So for example, it says on the top of your care plan, which might not be applicable to other localities, which we would be able to tweak. And yeah, we would also really, really welcome your feedback as well. So perhaps we can send out a watermarked version with the slides. And yeah, if that's something you'd be interested in, do let us know. But we would really appreciate and love as much sort of, yeah, feedback in general about them. So yeah, those are the leaflets. Thank you very much.
Brilliant. Thank you very much, Neelam. Well, there's some comments coming through and people who are keen to pilot them in different localities. Oldham seem that they're very keen. So we would be really interested to hear from anybody who would like to pilot them in your local area, and that would be really fantastic to get some feedback. We'll set up a bit of an evaluation project in relation to that. So please do let us know. Thank you, Neelam. Really helpful and brilliant overview and summary of that excellent piece of work. So thank you. So now we do have a little bit of time for a Q&A. So perhaps if everybody who was involved in presenting, so Catherine and Lisa, Jane and Maya, if you're happy to just come show yourselves on your camera again. Thank you. Welcome back. And I'm not sure what questions have been put in the chat, but if there are any particular ones, or if somebody from the programme team can be collecting those. At the same time, mindful, we always try to keep to our time limits in this and struggle because it's always such a fantastic, rich resource of information shared. Perhaps we would benefit from putting the Mentimeter number in the chat as well, so that people can give some feedback on today's webinar. So there's multitasking required now. Any questions for the panel that you would like to ask, please put it into the chat. And we would also really like feedback using Menti. So we have, perhaps is there a Menti slide that we can just show for, it's in the chat, but it's www.menti.com. And there's the code. So you just literally go to menti.com. I'm sure most people are familiar with that by now. Just put that www.menti.com into your search, and it will come up, and then you're invited to put in the code, and then you put in the code 2737430. Just give everybody a moment to do that. Oh, not open for voting. Thank you, Sarah. Could somebody from the programme team just perhaps check that Menti? So then, while we're opening the Menti, if anybody has any questions, or if somebody else from the team is, I'll just open the chat and have a great look through, a quick look through, sorry. Yes, great designs. There's some nice feedback about the leaflets. Lisa Slater asking, as well as leaflets, will there be posters? That's a really good idea, actually, Lisa, putting those up in different settings to be able to support young people in being able, you know, wherever they are, being able to read those as well as having the leaflets available. Yeah, really, really good idea. We can incorporate that into the final iteration. Yeah, great that you would like to use those. Let's follow up on that afterwards. Really lovely feedback for Maya about how inspirational your presentation was, and thanks for sharing your journey and insightful tips. Thanks to Jane and lots of people wanting a copy of your Gorilla Guide, and we put your website into the chat as well. Brilliant. That's what it looks like in real life. Yeah, so we'll have to follow up with you about how we managed to get our hands on those, and perhaps if people email the programme team, and we'll certainly take that forward to distribute you on your behalf. Sarah Farnell asked about the issue of clinical record systems and how they can be Thrive aligned, and I think, yeah, as we raised the challenge of not having shared systems across all parts of the system poses real challenges in implementation. There is an implementation story actually on incorporating the needs-based groupings into an electronic patient record system that we did within the Tavistock. Probably benefit with being updated, to be fair, but that might be a helpful resource, Sarah, to draw some learning from. But Lisa, you did mention that in your presentation. I wonder if there's anything that you would be able to share.
Yeah, absolutely. Thank you. So how it works on our system, I agree with what the person said. Having different systems is a real big problem. I mean, we're on a hospital site, and on this hospital site, we already have 2 different systems just on one site. So it is, I know it's very, very frustrating. How our system works. So I obviously can't go into the technical bits of it because I don't know how that our IT system set it up. It did take a very long time. But from the moment a referral is accepted, it goes through into an assessment pathway, and following that assessment pathway, we try to, as best as possible, we identify a presenting problem, and then we will align it to areas, and we can do it to all 4 areas, so it doesn't have to be, oh, you're just putting it into getting help. We can align the record to all 4 areas, and in each area there's like a drop-down care plan. And so if, for instance, the risk support, so our risk assessment will be in that section, or if it's getting help and signposting, there might be, so when we get our iThrive directory, that would go into that. So anybody who goes into that system can click and have a look at what that pathway offer is.
Fantastic, thanks very much, really helpful. Okay, and Sarah actually said that it would be great to implement the leaflets in Calderdale, so that's another interest. So we'll follow up with you as well, Sarah. There's a question, Catherine, to you about how long did it take you to implement Oldham Bees? What's the biggest challenge in bringing it to fruition?
COVID, probably. I felt we did the work pretty quickly because we've got a fantastic pool of young people to pull on their sort of expertise and their lived experience. So actually the concept of the bees, the poem and the rap and the graphics, all in all probably took about, because obviously it's we have other things to do in the day, we weren't just focusing on that, probably took about 6 months max to get all that sorted. We were doing a physical launch just as COVID hit. So now we're doing a virtual launch on the 23rd, but we had that done and dusted in about 6 months really. And I think the reason for that also is because our strategic partners were so much on board, and we linked into the right subgroups and sort of different groups. There was no duplication. Everybody understood within the borough what was going on and why. So I just think that top-down good communication really helps as well. Otherwise, projects sort of get lost or duplicated, but we identified it as a very clear project with very clear timescales on. So it actually wasn't difficult at all, if I'm honest. I don't feel.
Brilliant, thank you very much, Catherine, and well done to you all for your tenacity in pursuing it and following through with it, so that, you know, it's such a brilliant resource to draw on. And of course you've got your launch coming up, so we look forward to hearing how that goes, and you know, perhaps an implementation story is a good conduit for getting that out as well, which would be really fantastic. So we're mindful of time, and that bless her, Bethan has just tried to sort out the Menti in the background, but the problem remains. So we're not really sure. It's the first time that's ever happened. If everybody's okay with it, what we'll do is send out a Survey Monkey to collect your feedback after today's event. So please do, you know, respond to that. We realise we'll miss some data capture there, which is galling, but you know, please do take the time to give our feedback, and we can certainly share that with presenters as well. So what I'll do now is actually draw today's webinar to a close and just say thanks again to all our speakers. It's been really inspirational hearing about all that fantastic work that's taking place, and we really appreciate your time and commitment in preparing for today's webinar, and also obviously being here. And then just one final reminder that our hopefully last webinar before we move to face-to-face delivery again in the autumn, fingers crossed for the restrictions lifting, that remains to be seen, but we have our final webinar scheduled for the 8th of July, and that is, the focus of that is on applying quality improvement methodology to support Thrive framework implementation. So you know, as James mentioned, you know, certainly within the healthcare delivery, quality improvement is such a core part of improving the quality of our services, and something that is being thought about across all our integrated systems. So, you know, it's something that it's a tool that could be really useful for you in your localities, and the team have prepared some training to support sites in being able to take that forward in very practical ways. So do register. The links now there in the chat, but also you can of course access that through the Community of Practice website. So thanks once again. We're actually finishing on time, and you know, thank you all to our participants as well for taking the time out and joining our webinar today, and we look forward to receiving your feedback. So thank you all.